Lighting up the way. Valley Electric Association.
Well, this is a telehealth machine, Deanna. It enables us to be able to communicate with specialists and other physicians throughout the country, not just in the Las Vegas area, but throughout the country for specialty consults and consults that we may need for patients who are here at the hospital.
It has a camera on top?
It has a camera on top that and the screen shows the physician on the other end of the line, and they can actually do consultations as approved by Nevada law last session. And it's a very valuable tool, especially in rural Nevada, for people to be able to access care and not have to travel great distances.
So the legislature approved the telehealth bill. What was in that bill?
Well, the bill allows for not only for the physicians to be able to bill for their services on the originating site and the receiving site to bill for those services, but also saves a significant amount of money when people have to travel, and insurance companies sometimes have to pick up those travel costs. So it's a very exciting, progressive way for us to do health in the state of Nevada. Many other states are looking at our progressive telehealth legislation and monitoring it to see how it works.
So how does this machine work?
So basically what will happen is they'll dial into a physician will pop up, there'll be a nurse with the other patient, and if there's information that the physician needs it's of a medical nature, the nurse will provide that information. The physician will then evaluate the patient based on different criteria that they have for the different specialties and modalities that they're using, and then they'll move ahead and decide what needs to be done. If the patient needs to stay here, and they can be followed up through services here, if they need to be transferred. But most of the time, what we're anticipating, it's going to eliminate unnecessary transfers to other facilities and having to take people to Las Vegas or other places. They can receive their care right here.
Normally, the physician that you're calling is a specialist?
A specialist. Sometimes it's other folks that are other physicians that are of like kind that they're talking to, but this is truly an opportunity for not only the people in Pahrump, but across the state to receive care. It's one of the services that they're offering right now up at Nye Regional Hospital through Renown Health, that they're doing things up there. It's also going to be utilized in our correction system, what will eliminate having to take the prisoners out of those facilities with 2 or 3 guards that usually are working on overtime, and be able to have them consult with a physician right there within the facility.
Because that cuts down on a lot of risk and a lot of money within the detention center, as well as even here at the hospital.
Significant risk that when you are always outside the facility with the guards and things, but also saves the state money so we can allocate those funds other places in healthcare to make sure that they're utilized appropriately.
The Veterans Administration clinic right next door is using this right now?
The Veterans Administration is using this. 6-7 years ago, they used this for conferences and for treatment groups and therapy groups, and they use it right here in our conference room. So it's a tremendous opportunity for us to move again. It's just one more step in the electronic age of healthcare, and this is a great opportunity for us to have.
Really expands the whole access to healthcare throughout our rural area.
Right. So if somebody should need, for example, an orthopedic doctor, and we don't have one in the community, this allows a consultation with an orthopedic doctor to determine what the emergency room doctor can do. If they could admit that patient here, then they can come back at another time and render services or render care to them, maybe through surgery or other services that they need.